House lawmakers yesterday voted to advance a 3-year extension of the since expired Enhanced Affordable Care Act subsidies. It was a rebuke of Republican leadership because 17 Republicans joined all Democrats voting in favor of that legislation. It passed by a 230 to 196 margin. Both President Trump and House Speaker Mike Johnson, who called the bill, quote, really bad policy, opposed it, and now heads to the Senate, where it's expected to just kind of sit there. As Majority Leader John Thune has signaled, he has no plans to bring it up for a vote. However, a bipartisan group of senators say they're continuing to work on a compromise plan that could have maybe some chance of passing. Want to bring in Democratic Congresswoman Jennifer McClellan of Virginia. Congresswoman, you, of course, voted yes on that legislation yesterday. It was the result of Democrats pushing something called the discharge petition. Eventually, 4 Republicans lent the signatures to that petition, getting it to the House floor, rebuking leadership then, and then 17 of them total voting with Democrats now. I mean, what do you think this says about where Republicans are on this issue? I mean, you have conversations on the floor.
I think it shows that they're starting to listen to their constituents, and it's about time. It's a little too late since the tax credits had already expired. But, you know, I was hearing, Democrats have been hearing and sharing stories of people all across the country who were about to see their insurance premiums skyrocket beyond the point they could afford. To put that in context, I have a constituent who last year was paying $32 a month. This year, with the tax credit, he would have been paying $92 a month. Without it, he's paying $1,700 a month. He doesn't know how he's going to afford that. Story after story in Democratic districts, in Republican districts, and a significant percentage of people who rely on those tax credits live in Republican areas, live in states that Donald Trump won. Rural areas, farmers, small business owners, and they have been crying out for help because they just don't know how they can afford their health insurance with groceries going up and the price of everything going up. And they're worried, they're scared, and I think Republicans are starting to see they've got to take action to solve this healthcare crisis that they created.
But right now, this vote, while important and interesting for the dynamics that it teased out, is not actually expected to go anywhere. It's coming as the Senate, along with some House counterparts, are trying to broker something that might actually pass, whether it's a 2-year extension of this, then putting some income caps on it. All of these are, frankly, the negotiations that should have been happening early at the end of last year,
That's right.
but weren't because the House, in large part, was being kept out for about a month and a half during the government shutdown.
That's right.
So what is your level of optimism that something actually gets done here? I mean, what do you tell your constituents who are like, wait, did you just put this tax incentive back in? And it's like, no, not yet.
It's a process. It's a huge first step in a process to get to a solution, and hopefully we can do that quickly. I am an eternal optimist, but I'm telling all of my constituents and everybody, like, don't take your foot off the gas. Keep the calls coming in. Make sure that your representative understands that you want a solution to this healthcare crisis that Republicans created. I have faith we will reach some sort of solution, hopefully before the open enrollment ends in every state. If not, we are going to have to allow some sort of, special enrollment period. But we have got to solve this for the American people. They expect us to solve this for them, and we just have to do it.
But I do question, because yesterday I thought was a really interesting view of where Republicans might be to start a midterm year that many of them privately acknowledge is going to be really tough for them on a number of issues. You had Republican senators voting to pass at least an initial phase of a war powers resolution that would hem the administration in on Venezuela. I think that was surprising, a shift from last year. You've got, of course, this ACA vote where Republicans are crossing party lines. You had Congress entertain overturning a veto of President Trump. Even some of his allies were part of that vote to try to, stick it to him on these key pieces of legislation. Does it say that there is potentially more of an appetite for Republicans to work with Democrats? I mean, what do you make of what we saw yesterday?
I hope so. It shows me that some of them, at least, are beginning to put the interests of their constituents above the interests of Donald Trump. That they are starting to recognize that this president is not popular, that he got elected saying that he was going to lower costs, that he was going to keep us out of forever wars. He has done the exact opposite. Everything that he has done has increased pain for our constituents, whether it's what they've done to the federal workforce, whether it's what they've done to health care. And the American people are fed up. I know they heard from their constituents during those 54 days that the House was not in session.
Yeah.
Private conversations with some, they've admitted as much. they need to understand that there will be electoral consequences. If they don't meet the needs of the American people are going to vote them out of office.
I will say your state, Virginia, is going to be one of those key states that we're watching because there's several House seats there that Democrats are heavily targeting to flip. Even this ACA vote, seeing which members of the Virginia Republican delegation voted how, I think is going to be instructive and something that we keep track of for the next several months. Democratic Congresswoman Jennifer McClellan of Virginia, I hope you'll come back and keep us posted on all of it. Thank you.
Thank you.